Okay, now a quick tour of the cabinets. This is the room 19 for us. As you can see, everything is labeled. Everything is labeled, right, as you can see. So if you need gloves, they're in here. Gloves, mouth guard, tape. Now this mouth guard is what they use for the TEEs. You need to throw one of these on the TE, or at the very least onto your setup table on top of the machine. Here's the mini-med tubing. There's tubing for your platelets. Here's the fluid warmers, extra tape. In here is, they're going to ask, if they ask for a gooey dressing, it's this, gooey dressing. Had to figure out what that one was when I first got here. Blood work, they're going to do a cardiac output. If they need some ChloraPrep. Radial artery. Okay, now this is another thing. All your arteries, all of your A lines are going to be started with a radial artery kit, which are right up here. You're going to use this kit. You're going to draw out a guide wire. You're going to take a long 4-inch long sheath. You're going to eventually be starting an IV A line with this, using the guide wire to change it to the longer sheath. That is per Dr. Hello. She's the only doctor that does that. Everyone else will tell you just to use the regular one that comes in here. Otherwise, that's it. If you need A lines, all the stuff is here. You know, swans and stuff. But for the most part, the girls give everything that you need. Down here, the esophageal stethoscopes. Dr. Hello uses the LTAs. You need to put them right into her ET tube, nasal, pharyngeal, which they like to use, extra circuits, airway stuff. I mean, all of this is basic. Everybody gets a size 8 tube unless notified otherwise. Everything that you need is in here. You're going to need 2 of these, one for now, one for now, one for later. Don't take them both out, only take out the one for now. Extra saline, bear hugger, you won't even go in there. Syringes are here, all the different sizes that you need, which is important. Needles, suction catheters. It seems like every day they ask for a sat wrap. I don't know why, but know where they are and have them ready. And then in this final one is the Biz monitor. This is a cerebral pulse ox machine. You notice this is medium. There are larges, and for pretty much anybody over 60 kilos, you need a large. And the large is green, this is blue, and there isn't a large one here. But if you need them, the cardiopulmonary, the perfusionist can get them for you, I believe. And that's it. All this is blood tubing. Down here is just blood tubing. Okay, and that's it. You have your labels are all up here, everything that you need. I showed you already all of the labels that you have. Pretty much that's it. So otherwise it's the same setup's going to be here. This is a SVO2 monitor. This is the pulse oximetry monitor. The SVO2 cable goes here. If you're going to do a cardiac output cable, it would go here, but they don't even own one, so we don't have it. SVO2 goes here, and that they'll have to show you when you do a SVO2 monitoring, how to get that to plug that in. The cerebral ox is just a rotating number that comes up here that's like 75, 80, whatever. That's the O2 saturation in the head, and there's a left and a right sided probe, I suppose, that will be attached to the patient's forehead. Just be aware when you put on the Biz monitor that the Biz monitor, and you have room on the forehead for both of these contraptions. Excuse me. Otherwise, pretty much that's it. This is the TEE machine. You won't have anything to do with it unless it is you who puts in the probe. The clean probes are over there on the wall. The tech that comes to do this machine will put the clean one here. They are the only ones who are supposed to take it off of the wall. If one is left here open on the machine draped, it is considered dirty unless the tech is standing here to vouch that they were the ones who put it on. So all you have to do is make sure that there is at least one in there hanging in the sheath. It has happened where there were empty sheets over there and they had to call and make some phone calls, and I was the one who picked up on that. So just be aware that there is going to be a TEE done during the procedure and after the procedure. You just need to know that they're there. That is the tray that goes over the head of the patient. They're going to ask you to assist in putting that on, and in a timely fashion. It goes over the patient's face during the procedure, and they use it as a table for their instruments. This contraption here is the bladder monitor Foley. They have a square Foley that goes into that. It is the probe is connected to one of these monitors, and it goes up on the screen the bladder temperature. It sometimes will work to tell you how much urine the patient's putting out, but it's better just to eyeball it. From your point of view here, there are two monitors. There's one all the way over there. There's one all the way over there. You're going to be blocked for both of them. They match this one, that one. There's your biz monitor. Here's all of the stuff that's going to go to this little hook right here is where they're going to put the transducer setup for your A-line and your swan. So it's all at hip level to you where you are. But from your point of view, the two monitors you're going to use most are up there. Again, they match this one. And now this one, which is the one we're used to looking at, the only thing you're going to use this for is the nasal temperature. MAC levels in your gas and your end-tidal CO2 are all going to be here. Otherwise, everything else is going to be up on the screens. You need to clarify with the staff which clock they're going to be using, because if you can see, this is 1422, that one says 1422, everything seems to be 1422, everything in this room matches. In other rooms, they're a minute or two off, which makes a big difference when it comes to when they're going to be giving heparin and protamine and the timing of everything. Oh, I think that's enough with the setup. Anyway, good luck. Take care. Bye.